Okay, last section here, I just want to cover some myths and facts that are out there. Some of these hopefully actually are not such big misconceptions anymore, but the first one is that autism is more common in boys. And this is definitely a myth. So it's more commonly diagnosed in boys, but recent studies have showed that autism is equally likely to occur in all gender identities. There are many reasons that I could talk about for hours about why girls were less diagnosed, but suffice to say the research did not study girls, right? That's the biggest reason. And so I still to this day have clients who come in, and sometimes are older clients, and they were very clearly autistic throughout their lives, had a lot of the symptoms and the signs, but because they look a little different based on their gender identity, or we're not used to seeing it in this type of person or this type of, this gender identity, that they get ignored or they just slip through the cracks. So what we now know is that actually autism affects all genders equally, and that it might look different in different genders, and the presentation of the symptoms might be different. And the research is currently growing in this area to really try and better identify and close some of these gaps. But this is a myth. Another myth is there are different types of autism. Again, like we talked before, there are no more autistic, less autistic, and there are different people who present differently with autism, for sure, right? Like I said earlier, every autistic person is different. But there aren't different types of autism, at least not right now. I suspect at some point in the future, under the autism ASD umbrella, there might be different subtypes that develop, because I think there are differences that we can probably identify. But right now, I think it's best to think of, if somebody tells you they're autistic, they're autistic. There's no need to ask, well, what type of autistic? Or are you high functioning, low functioning? Again, those can be offensive labels now. So just remember that there are no other types of variations of autism. Everybody who's autistic has a different constellation of the common autistic traits and experiences, but it's all autism. Every autistic person has a different experience of autism. This is true. Obviously so, based on what that last one we just covered, right? But this is really important, right? Because I think even experts in the field can fall into this trap where we're used to seeing the very common signs of autism, but it's different in everybody. Just like, with depression or any other thing we can talk about, right? There are common experiences and traits and behaviors in autism, but again, every autistic person is going to have a different constellation of how these traits affect them, how they affect their functioning in the world. Just like that sounding board mixing analogy I said earlier, they might have a different kind of setup of where those levels are at. And so while there are a lot of common experiences, again, each autistic person has a different experience of those. So it's always best to always talk to the person or the student you're meeting with and really try and meet them where they're at and get to understand what their experience of this is. Well, this is a particularly nasty myth. It is absolutely a myth. People who are labeled as not having a conscious and empathy are typically labeled as psychopaths, sociopaths, or in a more clinically accurate term, antisocial personality disorder. It is very different than autism. This can be a very offensive thing for somebody who's autistic, because honestly, some of the most empathetic people I've ever met are autistic. And it kind of makes sense, right? They often have a lot of struggles throughout life the way other people are treating them. So they really develop and hone a very strong sense of empathy. It might look a little different, right? And it might come out or manifest different than the way a neurotypical person might express empathy. But that doesn't mean that they don't have empathy. And then last but not least, autistic folks do not have a sense of humor. Again, this is a pretty nasty misconception as well. They absolutely have a sense of humor. There's some autistic folks I've met are some of the funniest people I've ever met. If you've never seen any of Hannah Gadsby's comedy specials, in fact, her second one on Netflix is all about her experience being diagnosed as autistic, and it's absolutely hilarious. Some of my clients I work with have told me some of the funniest stories or funniest jokes. Again, they might express it differently. Their jokes might come across as a little coming from at it from a different perspective and a different angle for a neurotypical person, so they might not always get them, but they can be absolutely hilarious. And then again, autistic folks might struggle in other people's sense of humor and understanding it, right? Because they might struggle with sarcasm, because that involves a lot of being able to read the social cues and the tone of the voice that they might not be as skilled at, right? So I think that's where this myth comes from, is that sometimes autistic folks really struggle to know if somebody's joking or not, but that doesn't mean they can't be funny and they don't have their own sense of humor.